Hey, Odie's on Facebook. Welcome, everyone. We'll spend about 15 where Dr. Alan Glazier and myself, Dr. Masoud Nafey, where we speak a little bit about the lessons and opportunities that we've learned from COVID-19 and really how we can hopefully share some things that help everyone in the audience. So, Alan, I'll give you the floor.
Thanks, Masoud. Yeah, thanks for having me here today. I think tonight is going to be a great topic. We're looking at we're in a terrible situation now with COVID, but we now know there are vaccines, so there's light at the end of the tunnel. I think you had some questions you were going to ask specifically. Why don't we start with those?
Yeah, so first, I guess, in your from your perspective, what technology could help practices recover some of their lost revenue? As you know, many of our colleagues, their practices were impacted by COVID. Some places shut down completely. And so not only how can they recover some of their lost revenue, but more how should the processes change moving forward?
Yeah, that's a great question. So, in order to answer that question, we're going to have to project forward. And to do that, our best way is to look backwards and see what's happened in the past. And I know it was 100 years ago when our last pandemic here in 1918, but what happened to the economy as it relates to healthcare? And so they saw, as a result of the pandemic, uh, expanded access to healthcare. So you need to, as a practitioner of healthcare, you need to ensure you're in a position to be able to handle higher patient volume, maybe during or after. I'd say you want to start with anything that improves efficiency first off, so that you can handle that higher volume. In the post 1918 pandemic, businesses that specialized in healthcare products had a net increase in revenues, and people, outpatients specifically, will have a renewed interest in social contact. I think we've seen that already. I know people ran back into our practice
Right.
when they could, and they'll be trying to get things done that they delayed, like eye exams and new glasses. So think of all the people who decided not to continue to wear contacts because they're stuck at home. We're going to get much busier, I believe, which is a plus, but not always. As getting busier can equal growing pains, decreases in efficiency, lagging customer service. It's so,
Right.
I've always said it's so important. And one of the hardest things is to stay ahead of the growth. And you do that by implementing efficiencies in all areas of the office, including the optical ordering and processing, revenue management, patient flow. If you're able to, and I know a lot of us aren't, but if you're able to, a capital investment, this might be a good time for a capital investment in technologies and products that help you stay ahead of the growth. So to specifically answer the question, things that you can do, you can expand your offerings to generate additional bottom line revenue, like dry eye tech, if you're not already doing that, or up your game in dry eye. I'm a
Right.
big fan, as everyone knows, of myopia management specialty. It's high profit item, and it's so optometry. I mean, what's more optometry than managing myopia? Um, some of the virtual try-on
Hmm.
technologies are great, especially ones that allow people to do things at home to save them time when they come into your optical, and thus potential exposure to pathogens. Refracting technologies, digital exam lanes can keep you further away from the patients and also speed it up so you're spending less time in that room. As same thing in pre-testing, you want to identify constraints in flow in your office. A lot of that happens around pre-testing. So if you can add tools that will reduce those constraints, you'll have a better flow. People will be in and out of your office faster. They won't feel like they receive low levels of service. People are going to be more aware of how hygienic you are in your office. So hand washing, um, and other things like the UV cleansing tools for frames, I think, are going to be really popular. I think that shows your patients you're serious about this. You went that extra mile. Basically, anything you don't have that adds to your bottom line is going to help you with that, I think.
That I think you hit a couple things that I had thought about, which is obviously dry eye therapies. People being at home, they're spending more time on their screens. More screen time leads to dry eyes. We know that. Also, lens technology, right? How can you recover some of the losses in revenue? It's going to be recommending products like eyes and recommending products like blue blocking filter in your glasses, allowing these recommendations to make up for some of that lost revenue. But I think, you know, in order to even understand and measure what that lost revenue is, you need to make sure your reports are accurate. So obviously, having an EHR, practice management system, making sure that you have reports there that is accurately measuring your business, where you were versus where you are. You know, obviously, even analytics tools. You have tools like GPN Edge Pro that helps identify opportunities in terms of where you can actually maximize profit in your optical. Those are definitely certain ways. You hit digital refraction too. I mean, that's safe in that you could be 6 feet apart as well, right?
Exactly.
So let's go on to the next question I have here, which is, you know, practices have had to adjust to a change in process to keep patients and staff safe and distance. We hit this with digital refraction too. You know, how can automation help practices adjust to these new requirements?
Another great question. You know, I think we all can appreciate, especially right after we came back from the first, 2-month closure, that we have to go slower than we're used to going. So increases in efficiency and new ways of revenue, generating revenue, have to make up for the lost volume. So try increasing efficiency with less staff is not easy either. So we've got a real challenge ahead of us. It tells us even more that expected increase in volume combined with a necessity to slow down and function with less staff, that we're going to need new processes and new tools in place. It's important to look into software options that might help in the automation process. Clinically, for our healthy patients, we're using digital camera for fundus shots and delaying dilation in EO for the time being. It limits our exposure to them and
Mm.
vice versa. So if you don't have a great wide field camera, I strongly recommend considering getting one. It's been a huge asset. We had it before. We were very lucky. Optical wise, increasing efficiency in the ordering process is key. With everything patients are going through now, wait times for eyewear add to their frustrations, and you think you had a lot of Karens before. You're gonna have a lot more now. They'll take note if you can increase efficiency in product ordering and delivery, and I think that's going to be a big part of this. They're also, I think, going to be prone, at least in the short term, to order more so they don't from you instead of shopping around. And we may even see a slight decrease online sales for a while. So make sure that you deliver your products in a timely manner. That means keeping track of your lab orders as well.
And when you think about all the different places patients go make purchases of eyewear, I think they would feel more comfortable coming to actual optometry practice to make those purchases versus maybe a retailer. So I think that can help our independent optometrists. You know, when I think about how to keep patients safe, staff safe, I think about digital experiences. How about a digital check-in experience for the patient? You know, that check-in process. You know, a lot of practices still use paper. What if you have a robust patient portal that can allow you to have them electronically sign their HIPAA form, electronically sign their practice policy form, be able to obtain those prescriptions online? The FTC rule, FTC's contact lens rule, you know, that's even a requirement of us now. You know, you also hit, Alan, you hit online frame galleries, virtual trial. I mean, that's definitely going to help reduce time in your office. Imagine if we can get place their potential purchases in a shopping cart, so when they come in, they're ready to purchase or at least just look at the frames that they want to touch.
Exactly. Look, all of those things you
So,
touched on, the most important thing, if you, not to cut you off, Masoud, but if you look at all those things, they all enable the people do more stuff before they get to your office. So there's less time in the office,
right,
less distance. They're not visiting multiple places. Those are all important things to them.
right, and you know, one that we surprisingly haven't hit yet is telehealth, right? So limiting in-person visits while in practice, using it the best you can for your practice, maybe contact lens follow-ups, some of these medical follow-ups where we're just going to check in. I think those are also one of the ways that you can limit really human-to-human contact for your practice.
Yes, I agree. For now, and and
So,
during
so
times like this, it's a good option for when you don't need to, when you can't see them face to face.
Right, exactly. And I know there's times where we just have to, especially for our profession. I'll move on to my next question. It's really practices having to deal with furloughing and let going employees not wanting to come back because of the juicy unemployment benefits. What are some things that practices can do? Maybe some things they can outsource, for example, to manage their workload and staff with the ratios that they have for their business.
Yeah, we have to focus keeping patients safe and keeping our staff safe. So we have to adjust our resources. We had a certain setup before COVID, and after it can't be the same. For example, if you had an in-office biller, you might be better served outsourcing for a while before rehiring to reduce the number of people in the office. It should be a specialist. If you do that, it should be a specialist who can focus on the optometric revenue cycle management efficiently and effectively. If you look at these two
Mm-hmm.
items, ordering, dispensing, and revenue cycle management, they're both features that are offered by VisionWeb, by the way. So that's something to consider looking into.
Yeah, I appreciate you mentioning that. Also, Alan, I think if you think about automating as much as you can the process of uh, recalls and orders for your patients with technology services that offer that. I know some practices still have staff doing some of that, so automating as much as you can, just an additional point.
Absolutely.
So I have my question, and I'm sure this will take up most of our time. And it's really looking right in the next year or two. What investments can practices make and that'll pay off the most pandemic and post pandemic?
Yeah. You know, I'm going to go through these quickly and then we'll go back and revisit each one. First of all, advanced diagnostic technology is always important in any situation. Right
I
now,
agree.
if I had to bet, the companies that are going to do the best in COVID are ones that have products that allow you to operate further away from the patient with less exposure time. So I would look, I know a lot of people are going to be looking for that and should be looking for that if they don't already have it. Always tell people during normal times, but even more so now, considering adding a specialty is even more important than ever because we have to drive our bottom line revenue, and that's what specialty care does. When you're dealing with less patients,
Mm-hmm.
but you don't want your numbers to go down and you hope to keep growing, that's a great way to do it because those specialties have greater profit margins, and that goes right to your bottom line. Technology that drives bottom line revenue is also important. That's technology you can charge and bill for. Think of therapeutic devices like LipiFlow, things like that also add revenue to your bottom line. If you can make a capital investment, things that you can that those dry eye technologies you can walk out of the room too. So uh, and then there's practice management solutions like VisionWeb. They simplify, they add a layer of efficiency and profitability to your practice. And then there's people who have gotten behind on marketing. It's a great time to work on some of your marketing technology, build a great website, do search engine optimization, do the things, link up with one of the companies that's customer communication software companies and upgrade your efforts there because that is really going to help you.
I couldn't more. I talked about efficiency, the electronic health records. I mean, that's huge in terms of finding more, uh, not just efficiency, but actually being more productive while you have those patients in your office. And then the social media presence. I mean, everyone's on their digital devices more than ever before. That includes your patients. So, doing more social media marketing and then search engine optimization, as you mentioned, I totally agree with that as well. Um, I appreciate you
Even
answering all my
advertising,
questions. And
well, when we talk about the social media marketing, marketing really, you're not going to do flyers in people's mailboxes anymore. It's all going to be online, and the two
that's
big
right.
categories there are the social media and your ability to maybe advertise online, like Google AdWords. Those can be very productive for you.
And making sure your websites are up to date too, right? Having
Yep.
your patients understand all of your offerings on your web.
Right. I sang that song for a
Perfect.
long time and tried
Well,
to get people to listen to it. It's so important to have a great website.
totally agree with that. Totally agree. Well, I think our time is up. Thank you so much, Alan, and I hope our guests enjoyed our conversation together. Hopefully, we could do it again sometime.
Yeah, Masoud, it's great seeing you. We've had some fun times together, and look forward to those
Yeah,
in the
we
not too
have.
distant future. And I just want to say hi and thanks to VisionWeb for hosting this, and thanks to the community for giving it a look-see.